Every stroke spasticity exercise video you've probably seen starts with stretching, but this one doesn't, and here's why. Stretching helps with tight muscles, but spasticity lives in the nervous system. And if you never address that, your arm is going to keep tightening back up no matter how much you stretch it. So, I've designed this routine to address both the muscle and the nervous system. It's a full shoulder to hand daily routine with no aggressive stretching, minimal equipment, and something you can do on your own at home that actually targets the sources. So let's get into it. Before we start, here's what you need. All you need is a chair to sit on, a table in front of you, a pillowcase or a hand towel to work on positioning and comfort, and then something light to grab onto like a water bottle or a cup. And that's it. Now get yourself set up. I want you to sit close enough to the table so that your forearm can rest comfortably on the pillowcase or hand towel. Make sure your feet are flat on the floor for core support. And one more important thing before we get started. With all of these movements, we need to move this arm slow and controlled. Because if your arm starts to fight back up or your hand starts to clench down more, it's actually doing the opposite of what we're trying to do today. So we're not trying to win a wrestling match with this arm. We're trying to teach it how to relax and move. So are you ready? Let's start with the shoulder and we're going to work our way down. Before we even touch the arm, we need to make sure the body is in the right position, because a collapsed trunk and a hiked shoulder is going to drive more tone through the whole arm. So we're going to quickly fix that with positioning first so everything else works better. This first exercise we're going to do today is just upright sitting with a shoulder set. So start by sitting tall, chest out, head up, and rest your affected forearm on top of the towel or pillowcase. You can have your elbow slightly bent and just wherever the arm feels comfortable, whether it's the pinky side or the wrist down. Now I want you to bring your attention to your affected shoulder. We're just going to let it relax down away from the ear and gently pull it down and slightly back. Not like a squeeze, just a set. And just breathe. We're going to hold this position for 30 seconds. In this position, we are letting the table do all of the work. It's supporting the elbow and the shoulder, letting the arm completely relax. And this may not feel like you're doing much, but you are. Getting the shoulder and trunk in the right position before moving the arm is one of the most underused steps in home stroke recovery. So now that we have the shoulder set, let's move on to the forearm. So the second exercise is a supported forearm weight bearing with some slow rocking. Now with your arm and hand in the same position as the last exercise, place your other hand behind the wrist and slowly lean your body weight forward into the forearm. Just a gentle load here. And then we're going to ease back off. You can also lean side to side if that's more comfortable for you. And if this causes pain in your hand, then you can just roll up your towel and place it under your wrist while you do these, like this. Hand behind the wrist, lean forward, lean back. Pick one direction and continue rocking back and forth for the next 60 seconds. Remember, we're going to go nice and slow with these. No need to put all your weight into the arm as you're weight bearing, just enough to feel stable. And make sure you're putting weight through the arm even when you're backing out. So there should be some contact with the table throughout the whole movements. And this is just one of the more effective ways to calm that overactivity in your arm without forcing it through some aggressive stretching. And just think of it like sending some signals to your nervous system that it is safe, it's calm, and that it can let go. And pay attention to that shoulder as you're doing these as well. If you notice that shoulder hiking up, then just take a few seconds to relax and continue. Sometimes if the table is too high, you may need to add a pillow to sit up a little higher, and that'll help with reducing that shoulder hiking as well. So we got our 60 seconds in. Now let's move on to the next exercise. So now that the shoulder is settled, the forearm and arm are calmer, we're going to work on opening up that elbow and forearm now. So stage 3 and 4 stroke survivors often spend most of their day with their elbow bent, palm turned down, and wrist flexed. And we want to gently chip away at this pattern so that arm begins opening back up again. So for the third exercise, we're going to be doing some elbow extension table slides. So with a towel or pillowcase under your forearm on the table, we're going to slowly slide that arm forward, straightening the elbow as far as it'll go comfortably. And then we're going to slide back. And try to keep that shoulder relaxed the whole time. Don't let it hike up like this as you're trying to do your table slides. Keep it nice and relaxed and just focus on extending the elbow. We're going to be doing 10 slow and controlled reps here. And if you're not getting this much range or much range on this exercise, you can hook your hand with your unaffected side and assist with the movements. This hand should not be doing much of the work. It should be doing enough work so that the arm maintains movement. You can even just do a little pushing like this. Sometimes that can help a little bit if you're having trouble using this hand too much. So if that felt pretty easy and your arm stayed calm through the whole movements, then you can pause the video here and do another 10 reps. Now we're going to move down to the wrist and work on forearm rotations. So keep your affected arm on the towel or pillowcase like it has been with the last exercises, and just rest it the way that the wrist wants to rest it. If it's on the pinky side, that's fine. If it's more with the knuckles down, that's fine too. And what we're going to do is slowly rotate the forearm so that the palm goes up to the ceiling, just as far as it'll go comfortably. If you don't have any active movement or very little active movement with this one, then you can use your other hand to assist. But remember, it's just assisting with the movement. So you're just maintaining movement through the whole range. That's it. We're doing 10 reps here. And remember, you don't have to reach full palm up on these. Any rotation in that direction is progress. And once you get to that end point where you're feeling that tightness, you can hold it for a second or two, relax, let it go back to its position, and repeat. So the fifth exercise we're doing today is going to be bringing the wrist to a neutral position and holding it there. So in this exercise, we're going to be trying to fix that bend in your wrist. So start by grabbing the pinky side of your affected palm. And I like to put my thumb in the middle of the palm and kind of wrap my fingers around the wrist to give it the most control. So once you're in that position, you're going to slowly bend that wrist to a neutral position or straight. If there's stiffness there, you hold there. If not, you continue going into extension until you feel the first sign of stiffness. And we're going to hold this for 20 seconds. If you do start having more clenching, or if it feels like it's getting stiffer holding it there, you can ease off 10 to 15 degrees and continue holding. So once we hit our 20 seconds, we're going to relax, release that position, and rest for 2 to 4 seconds, and then we're going to go right back into another 20-second hold. Again, this is not a stretch. We're not pushing into the stiffness. We're just positioning and parking the wrist in a more open position and letting the nervous system get comfortable there. Moving on to exercise number 6, which is assisted hand opening holds. All we're doing here is we're going to bring that wrist to neutral, and we're going to work on bringing that palm up. And it doesn't have to be perfect here. And then we're going to take our other hand and we're going to go under the fingers, and we're going to slowly start opening them up. And we're going to stop at that first resistance. And we're not going to go past it, just to where they will go comfortably. And we're going to hold that open position for 30 seconds. And remember, while you're doing these, like with everything, keep that shoulder relaxed. Keep the forearm supported on the towel. So after 30 seconds, we're going to release and let it relax for 2 to 4 seconds and reset. And then we're going to go into another set. Wrist neutral, palm pointing up as far as we can comfortably, fingers straightening out. And we're not going to be cranking those fingers back with this. We're just going to that first sign of resistance. So this is called a positional hold, and it's not a stretch. This is a signal to the nervous system that it's safe in this position and that it can relax. And the more consistently you practice this, the more the nervous system learns that this is how it's supposed to be. And that's how the hand starts opening up over time. And now we're gonna ask the arm to actually do something. We're gonna be doing some active movement, even if it's assisted. And this is where the nervous system starts learning new patterns. This is where real recovery is happening. So the next exercise we're gonna do is a reach and hold slide. So the towel is under the hand in the same position. And this one, what we're doing differently is we're gonna have the fingers and wrist open so the palm is on the table. And that's what's gonna make it different from exercise 3 because we wanna maintain that open hand position while we're doing the movement in the arm. So once you're in this position, as open as you can be, we're gonna reach out forward as far as you can, nice and slow, get to the end that you can reach, hold for a second or two, and then pull back. And we're gonna be doing 10 reps here. So reach out, keep those fingers and wrist nice and relaxed, hold for a second or two, and pull back. And if your fingers are starting to curl up with this one, then you can grab your water bottle and place your hand on the water bottle for a little bit of comfort and support. And we're gonna continue with this. Nice and slow, forward and back. Hold for a second or two at the end range. And remember, the shoulder here needs to be nice and relaxed through the whole movement. So if you feel that shoulder hiking up, you may want to either push out less far or stop for a second, let the arm kind of relax, and then continue focusing on straightening out that elbow and reaching forward. If you don't have movement, remember you can always add in some assistance from your unaffected side. Again, we're just trying to assist enough to maintain that movement. A couple more here. So we're gonna finish up this last one and then move on to the next exercise. We're getting to the end here, just 2 more exercises left. This next one is gonna be working on assisted wrist extensions. So we're just bringing the wrist back like this. So I'm gonna start with our forearm on the table with the pinky side down, and we're just gonna start bringing that wrist back as far as we can. If you're having trouble with this one, you can use your other hand to assist. Just like with all the other ones, we're going to that first point of resistance. We're gonna hold for 2 seconds and then release, relax, and then go again. Bringing the wrist back, holding for 2 seconds, and then releasing. Reset, bring the wrist back, hold for a couple seconds, and release. If you don't need your other hand to assist, try and just do it on your own with your affected side doing all the work. That's going to be the best form of this movement. We're just doing 10 reps here. So if you don't have any movement yet, keep mentally practicing while assisting with your unaffected hand. So even if you can't feel any muscle firing yet, the intention and the mental practice matter. There's been a lot of research on stroke recovery and mental practice showing that trying to move, even when nothing is happening, still activates the same motor pathways in the brain of the actual physical movement. So even if you don't have movement, if you're mentally practicing these movements, you're still getting the same kind of stimulation to the brain as if you're actually moving. Now we get to the most important phase and the most underused. The upper limb is best supported by real repetitive practice, not just exercise, actual functional everyday tasks. So we're gonna finish this exercise video with a nice functional task. So go ahead and get your water bottle or maybe like a hard plastic cup in front of you at the table. And what we can do is we can just wrap our fingers around the cup or bottle. So get something that you can hold comfortably. And we're gonna keep this out in front of us, this bottle, this cup. What we're gonna do is we're gonna pull it in like we did in some of these exercises. And then we're gonna pull it up to our mouth like we're gonna take a drink. Hold it for a second or two, then come back down, nice and slow and controlled. And then we're gonna push it back out in front of us. And that's 1 rep. And we're gonna be doing 8 here. So try to keep these movements slow and controlled. Pull back, lift up, take a drink, place it back down, push it back out, okay? Just like that. Keep that shoulder relaxed. If you're having trouble getting it up, it's okay. Again, do your assistance. It's okay. Down and out. Pull back. Bring up, take a drink. Down and out. You got a couple more of these. Pull in, take a drink. Down and out. So 2 more of these. Last one. Pull it in, take a drink. If you need to assist, you can assist a little bit. Bring it back down and slide it out. So we ended with a real task on purpose because everything we did in this routine, calming the nervous system, restoring alignment, opening the hand, it all existed to make this movement possible. And the research on stroke recovery is very clear that repetitive task-specific practice is the most effective driver of neuroplasticity. Your brain rewires through doing real things repeatedly, not stretching, doing. So do this every day. And if you want the complete structured system built specifically around opening a tight and spastic hand, the Open Hand Protocol takes everything you just practiced today and builds it into a step-by-step 15-minute daily program designed for exactly where you are right now. The link for that is in the description below. And if you want to understand exactly why stretching alone isn't enough to fix spasticity and want to know what to do instead, then watch this video next, and I'll see you there.